Open letter to President Bola Ahmed Tinubu on Nigeria's healthcare crisis. Your Excellency, we understand that you inherited a retrogressive economy. And we understand that you are being saddled with many responsibilities on all fronts. However, our healthcare crisis should not be left for later, because this sector has suffered enough. In April 2001, heads of state and government of the African Union, including the then-President Olusegun Obasanjo in Abuja, signed and committed to allocate 15% of their annual budget to improve the health sector. Despite the promises, no major increase occurred except the 5.75% of the total budget allocated to the health sector in the 2023 budget. There is no gainsaying that Nigeria's healthcare system is ill-funded. Meanwhile, apart from the meagre budgetary allocations, other challenges to healthcare in Nigeria include infrastructural deficit, brain drain phenomenon, poor medical education, lack of technology, inadequate research and development, inadequate healthcare insurance coverage, lack of coordination between private and public health sectors, and insufficient synergy between healthcare workers, to mention a few. Your Excellency, the contents of the Renewed Hope Action Plan on healthcare are not sufficient to be seriously considered for the robust attention the healthcare sector deserves. The healthcare system in Nigeria demands dynamic, innovative, and multifaceted approaches to tackle the challenges. The focus of this open letter is to propose how to significantly improve healthcare access in Nigeria. The mass exodus of healthcare professionals, especially medical doctors, in Nigeria had further impoverished the healthcare sector, making proper healthcare access a mirage for ordinary citizens. Unlike one medical provider to 560 patients recommended by the World Health Organization, Nigeria's healthcare access has reduced to one medical provider to 10,000 patients, according to the Nigeria Medical Association, NMA. No amount of capital injection will easily abridge this huge deficit. Consequently, it is pertinent that you consider other alternatives to providing a quality workforce to replenish the lost workforce of foreign adventurers. Like other developed countries in the past or present, Nigeria is experiencing a marked shortage of healthcare workforce. For example, in the 1960s, the United States was faced with a similar shortage of medical doctors. As such, the United States Congress came together to enact a law that established the physician associate profession. Today, the United States has more than 168,000 physician associates across all medical and surgical specialties in all 50 states, the District of Columbia, and U.S. territories, providing more than 3 million patient encounters per day. Anyone may ask, who are the physician associates? Physician associates are mid-level medical professionals who are trained, using medical models to perform tasks such as obtaining patient medical histories, performing clinical procedures and clinical examinations, diagnosing diseases, and formulating medical management plans. Physician associates are trained to provide general healthcare services, similar to medical doctors, but with the supervision of a principal or supervising physician. Physician associates can practice in all specialties as long as a supervising physician exists and is available. A supervising physician can supervise as many physician associates as possible. The supervising physician does not have to be in the exact location. The supervising physician should be a phone call away and be in the same specialty. Like medical doctors, physician associates undergo rigorous medical education, including didactic and clinical clerkship, and pass the board examinations before being allowed to practice. The preferred Nigeria Physician Associate Program model shall adopt the United States' 4-year bachelor's degree and then intense master-level education of 2 years, including didactic and clinical. Apart from the United States, several other countries have adopted the physician associate profession, including the United Kingdom, Canada, Netherlands, India, Liberia, Ghana, South Africa, Australia, Saudi Arabia, Germany, New Zealand, Afghanistan, Israel, Bulgaria, Ireland, Kenya, and others. In fact, some of the $1.6 billion being spent on medical tourism only earned those Nigerian medical tourists encounters with physician associates abroad. If enacted into law in Nigeria, Apart from providing a reliable workforce in the health sector, the physician associate profession will help establish a new profession for teeming youths who could not gain entrance to study medicine in universities nationwide. It is estimated that employment opportunities will be immediately created for hundreds of thousands of youths, who will be gainfully employed within the public and private sectors. More so, trained physician associates, including Nigerians practicing outside the country, will be able to return home to practice their profession in Nigeria. The physician associate profession will help generate economic activities and transform Nigeria's healthcare system. The physician associates will readily work in the rural, primary, and secondary healthcare systems in underserved communities, improving access to healthcare services and reducing quackery in the healthcare sector. In 2022, this rider facilitated the sponsorship of Bill HB 1966, Institute of Physician Associates of Nigeria Bill, 2022 through the 9th Assembly of the Nigeria Federal House of Representatives but failed after the first and second readings and public hearing on 12 August 2022 due to the opposition from the special interests. But as a pragmatic and dynamic leader, I am very confident that Your Excellency would see to the enactment of a bill for the downtrodden Nigerians who are not able to properly access healthcare services, thus dying needlessly. This letter was first published in the Nigerian Independent newspaper on May 31, 2023. Unfortunately, we have not received any response to date. MKO Bola holds a doctoral degree in Physician Associate Studies in the United States of America. He is a Harvard Medical School scholar. He specializes in internal medicine, acute care and emergency medicine, geriatrics, psychiatry, and surgical services.